What does informed consent for Adderall look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Adderall, which is a type of stimulant. So Adderall is an amphetamine-based stimulant. So in contrast to the methylphenidates, which is the other type of stimulant, this not only inhibits reuptake of neurotransmitters like dopamine and norepinephrine, but it also causes vesicles to release these neurotransmitters. So we do think of it as being a little bit more powerful than something that's a methylphenidate-based derivative. What is it used for? Well, typically it's used to treat ADHD. However, it can be used in some cases off-label for treatment refractory depression. We usually think about this use in atypical populations, maybe people who have like a terminal illness or really severe psychomotor slowing type of symptoms. As far as ADHD, we usually think about starting this type of stimulant, so an amphetamine-based stimulant in adults, whereas in kids, we usually think about starting a methylphenidate-based derivative, something like Ritalin. So there are a lot of different formulations of Adderall, but for the purpose of this video, we'll be talking about the short-acting Adderall, which usually has an activity of about 4 to 6 hours. Now, in kids, you often start with a short-acting version of the medication. In adults, we often start with a long-acting version, and so this medication might be used in the afternoon if the long-acting one doesn't last long enough, or some people, for some reason, can't tolerate the long-acting, or they just need their medication for bursts of focus here and there. And so for those people, a short acting might be a good option. As far as side effects, it's going to include things like decrease in appetite, increase in anxiety or agitation. It is pretty activating. It's a stimulant. It can cause insomnia, and for vulnerable individuals who maybe have a history of bipolar disorder, it can trigger things like mania or agitation or even psychosis. It's also going to cause an increase in your heart rate and in your blood pressure, and there can be risks associated with it for people who have cardiovascular issues. If someone has a family history of sudden cardiac death or a personal history of cardiac issues, then it's important to collaborate with their primary care provider or cardiologist before starting this type of medication. And even for those who don't have a history of cardiac issues, this medication can cause palpitations, like funny heartbeats. And so if that's the case, it's important to get some workup, get an EKG done so that we can make sure there's no dangerous arrhythmia going on. Now, some other things we worry about with this medication are that it can be abused and misused, especially the short-acting version, because it's pretty reinforcing when you get an immediate effect. And for this reason, it's a controlled substance. So it requires a specific type of prescription from your doctor, and there's going to be monitoring on part of your doctor and the pharmacist. It can be dangerous if it's used in combination with other stimulants, so things like cocaine or methamphetamine, as well as other prescribed medications, things like MAOIs or antidepressants. It does increase serotonin, and so it can increase the risk of serotonin syndrome, and it can interact with certain blood pressure medications as well. There's also the risk of tolerance, meaning that you need a higher and higher dose to get the same therapeutic effect. So the only way to decrease the risk of this happening is to minimize the exposure. So I like to use this type of medication as needed, especially for the short-acting version. If it's something they're taking every day, usually I'll prescribe a long-acting version. Dependence is not as much of an issue for the stimulants. Of course, you will go through a mild withdrawal, which does mean that your body is in some way dependent on the medication. However, it doesn't require the same hyperbolic taper as the other psychotropic medications. Withdrawal is going to look like the opposite of the intended effect. So that might look like drowsiness, fatigue, hypersomnia, meaning sleeping a lot, depressed mood can be one, but this usually is going to resolve within 48 hours or so. And the nice thing about this medication is that because it's short acting, you're only going to have those side effects when it's in your body. So if it's not working for you, you can just kind of stop it, and that will resolve the problem. These medications are very effective. They're one of our most effective medications in psychiatry. It's 80% efficacy after trying one type of stimulant and 90% after trying 2 types of stimulants. SSRIs are nowhere near that. So of course we would go through the risks versus benefits for that individual that I was talking to, and we would make a shared decision from there. If there's another psychotropic medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content, because I may have future courses or offerings or resources and want to be able to share those directly with you. So if that's you, then send me a DM with your email, and I'll see you in the next one.